Rich countries are opening up societies and vaccinating young people who are not at great risk from COVID-19, while the poorest countries lack doses. The World Health Organization has condemned a global failure to assist poor countries with vaccinations. The WHO has raised concerns with the situation in Africa, where new infections and deaths has jumped by nearly 40% last week compared to the previous week as the Delta variant spreads globally. Canadian health and human rights advocate Adam Houston is calling on world leaders to share vaccines. For more on this, he joins us via Skype. Mr. Houston, a very good evening to you. Thanks for joining us. Welcome to the Globe.
Thank you very much for having me.
Now, the well-off countries like Canada, for instance, are purchasing far more vaccines than they need. But isn't it logical that each country would prioritize self-preservation in a crisis?
Right. No, absolutely. That's true to an extent. And the very flawed analogy that's been used here is, if there's an emergency on an airplane, you're supposed to help yourself before you assist the person sitting next to you. And that makes sense as far as it goes. But at the moment, looking at Canada, for example, we're really waiting until the plane lands before helping the people next to us. Just to give you a little bit of context, so Canada has about 38 million people, so about two-thirds the population of South Africa. By early December, we'd already secured, through bilateral contracts, more than 400 million doses of vaccine. And thus far, of those doses, we have made firm commitments with dates and amounts to share exactly 0 of those doses. So, to be clear, this does not mean that Canada has, a warehouse somewhere with all these doses ready. We actually don't manufacture any of our own COVID-19 vaccines, which is part of the problem. But it does mean that we're at the front of the line for these doses. They're spoken for, meaning that other countries are unable to access them. And at the moment, we're not committing to sharing those doses.
How, in your view, could a country like Canada better balance its domestic rollout with its charitable obligations to the rest of the world?
Right. So that question, I think framing that question as a charitable obligation is in fact part of the issue. There's a charitable component I'll come back to. But if we look at a mechanism like COVAX, South Africa, Namibia, Botswana, these are all self-financing members of COVAX. They're not waiting for charitable doses. They're waiting for doses that they've paid for that other countries have cut in line, essentially, for. We've seen recent interviews with the negotiating team from the African Union who were going in December, cash in hand, to vaccine companies and saying, we've got money. We would like to buy these vaccines. And being told, no, things are stocked out because other countries have already purchased all our vaccines really for 2021. So it's more of an issue not of, Canada and other wealthy countries, sharing crumbs from their pie. It's about countries like Canada taking more than our share of that pie. To be fair, financially, Canada has been very generous in terms of financial donations to mechanisms like COVAX. But unfortunately, just like, if there's no food to buy, you can't eat money. Well, at the moment, you also can't inject money. The issue right now is vaccines. And unfortunately, even though we're predicting that we will have enough vaccines to vaccinate everyone in the country by the end of July, we have not actually set any dates for sharing any of those bilaterally contracted doses. It's very disappointing.
Yeah, and what would your input be regarding allowing India and South Africa's proposed TRIPs waiver and general technology transfer?
Right. So the TRIPs waiver is certainly an important piece of the solution. It's not the sole issue. It's not a complete solution by itself. But at the moment, what we need to do is get it done. Whether you think intellectual property is a small issue or a big issue, it is an issue. So if we just get the waiver passed, get it off the table, then we can address all the other barriers, focus on them, get this out of the way. As for technology transfer, it would be great. We'd love to see that happen. There's certainly experts who can speak with more expertise on the new South African hub, which is, again, a great idea. But all of these solutions around tech transfer are going to depend on, companies actually sharing that technology. And at the moment, we really have not seen enough of that, unfortunately.
And just looking at the current vaccination trends, how far or maybe how long would it take for Africa to get back to normal? And how does it affect the rest of the world, considering that no one is actually safe until everyone is safe?
Right. That's a very good question. I would love to believe that some of the more pessimistic predictions, 2023, 2024, are incorrect. Certainly organizations like the WHO would have more expertise on the exact timelines. But, looking at this issue, less than a year ago, our Prime Minister Trudeau and President Ramaphosa co-authored an editorial in the Washington Post on exactly this issue. No one is safe until everyone is safe, and the need for vaccine equity. But since that time, we've seen this divergence, and there's a real concern, I think, in my view, that once countries like Canada are back to normal, and once we can travel to other countries, the US, Europe, that are also back to normal, that we're really going to see a situation reinforcing existing disparities in terms of travel. So I really hope that we don't forget about the rest of the world. But unfortunately, at the moment, it seems a little bit that way.
Yeah, in terms of the international bodies, the United Nations, for instance, what should their role be in terms of sort of coercing those rich countries who have been accused of hoarding these vaccines to start sharing?
Well, we've certainly started to see some strong words from Dr. Tedros and others at the WHO. To be honest, I think we should be calling out more countries by name to say, hey, look, recognize the things that are good, financial donations and so on, but nobody needs 10 doses of vaccine secured per capita. There's absolutely no reason that Canada could not at least say, yeah, we'll be done in July. August 1st, we're going to start sharing, at least a percentage of our donations. I think the WHO could be saying this and is maybe moving in that direction. I'd like to see more pressure of that.
All right. Adam Houston, great chatting to you. Thank you so much for your time.
Thank you very much.